so he can just pull that and it comes off. He doesn't got to try and untie it or anything.
Did you see that? How he did that? Yeah. You want to see it again?
All right.
So you
you should do it again just because now it'll be on camera.
Pull two sides across, come up, tuck under, pull it taut, and leave yourself a little flap right here.
That way he can pull on either one of those and that'll come undone. Now, take the alcohol swab, you swab from the inside out in a circular motion. Circular motion. It's just cleaning the area.
Sharp, please. You get that
okay. Alright, since everyone's got their hand busy with video cameras, I'll hand the medic this.
Only one hand.
And then I'm holding the cap inside
I'm
so that when he pulls it, no cap on it. He can do it. There you go.
Now I'm going to say sharp out. I'm going to break my cap to make sure it comes off appropriately. There's many different ways to go ahead and puncture the actual vein. Some people like coming in on the side of it and coming up into it. That's the technique I was taught. That's the technique I use. So you go ahead, if you touch it again, you got to clean it again. So I'm not going to touch it again.
And I come down underneath the vein.
He comes down underneath the vein, so he goes up and in, so there's no chance of maybe even hitting a valve or something like that. So I'll take a note, I'll take a page out of his book. Ready? 1, 2, 3.
Alright, now you're going to see a flash inside as soon as he actually hits it. There you go, he's in it. See there's blood on the inside?
See how that's filling up?
That means he's in the vein. Okay. Now what he's going to do is you go a little bit, you advance a little bit past that, and then you advance the catheter, click it, tamponade it, really tamponade it, take the tourniquet off.
Now I'm gonna pass this away and say sharp away.
Sharp.
I'm gonna ask you to go ahead and hand me my flush.
Oh yeah.
All the while I'm holding pressure on this. If I let go,
I'm gonna bleed like no other.
Like a stuck pig, baby. Go ahead and hold that. Remember what I said about the cap?
Turn.
No. You're taking the whole part off. Go ahead and take the wrapper off. Take the wrapper off. Now take that cap off. No. Put it back on.
Don't.
Push. Apply. He needs a little help here.
Can you smell? I do.
And Matt, I'm gonna need a little 4x under here. See, he's just taking the plastic part off.
Twist off.
It's actually
not a twist off. You just twist to make it easier to get it off. Oh.
Now, I took it from you. I'm going to have to reflush it because you opened it. To make sure there's no envelope in here, right? This comes in like this, twists onto it.
Flush it.
Flush it, going in.
He's flushing through a 24 gauge, so it's a little bit more difficult.
It's a 22.
It's 22.
It's a 22. I can draw back on it to check patency. I'm getting blood coming back. And that's all she wrote.
Alright, now he's going to twist it off to where the lock stays on there.
Cold.
Yeah?
The lock stays on, but the flush comes off.
Now I'm holding this in place.
Now that it's in place and he's verified that it is in the vein by flushing it, and he has flushed it all out, he's going to need the tape.
Okay, when you hand the tape, give me the sticky side. There you go. Turn it around again. Perfect.
Now, he uses a chevron, I think, like I do. You put it underneath, and then you cross over the top of it. It's an extremely effective way of getting it not to go anywhere. And then you use the second piece of tape, Mike.
Go right on top.
And then this should go right over the top of the lock.
Take one more here. And then you can do one more for an added safety measure, right underneath the lock, coming back across this way.
Alright.
That's
So
it.
now I'm handing him this.
Note how he's holding it. He's holding it away so I can twist away. Coming into it. Now this is a lure lock, so what that's going to do is this is the movable part. This is the movable part in it. It comes up and snaps into the actual lure lock. So we go up and in.
Locks on there.
Locks on there.
And then once it's in there, you're going to open the bag up. Make sure that you get flow in the chamber. It's flowing. We know that it's working. So you know that the IV's open. And then you're going to adjust it to your desired rate, which for Adam, we're going to just do TKO, which means that it's just open enough to keep it dripping. So that's about right. You know, just enough to keep it dripping. That means that we can leave it alone. We're not going to give him any significant fluids this way. We might give him 10 cc's, 15 cc's over a trip.
Exactly. And
but if we need it, it's here.
We have a patent line into the patient.
So now we have a direct access to give medications, fluids if necessary, and access in case anything happens.
Another safety measure, because sometimes lines do get snagged during transport, is taking the actual line here, crimping it like such, coming into it, and then coming down on the patient like this, so that in the event that something snags or something gets pulled, it's actually going to pull on his skin and it's not going to pull the catheter out. So this is another added safety measure. People like going through and around here and coming back directly on that same piece of tape. So what that's going to do is that's going to keep our line all in place. And we have a port proximal to the actual patient that I can get to. That way, in the event that something happens, a line gets snagged, gets yanked, it's not going to actually pull on his catheter and pull it out.
When catheters get pulled out, it usually makes it a nice mess. Because especially if your bag's going, you're going to drip fluids all over the rig, and you're going to get blood all over the rig.
You feeling it? Is it going in?
Yep.
It's TKO right nice. Need some fluids?
And then in the event, guys, in the event that there's a hiccup or something goes awry, where we say we've blown our vein, you'll note there'll be some discoloration, or there'll actually be some actual swelling in and around the venipuncture site.
Go ahead, Vince.
So we'll say we're going to shut down now. So what we'll do is I'll throw my sharps away, and I'll make sure that I go ahead and remove the actual catheter. Take a 4x4 pad.
It's in the rig.
This is something you guys will do also as EMTs. You'll go ahead and take the actual 4x4, fold it over. If I need to go ahead and take that out, you get it ready as such. We'll put direct pressure on the actual area, remove the catheter, and we'll tape that up and ask the patient to go ahead and crimp up.
Well, we're going to have to remove it so we can show them when we actually remove it.
Okay, perfect.
All the IV bags have this neat little hole on it, the top. In our rig, we have hooks on the ceiling. You guys have it in your rigs on the ceiling. You might not have ever used them, but that's what they're there for. We also have the IV poles on the gurney. Just make sure that you have this above the patient's heart, whether it's down here or way up top. It's got to be above the patient's heart, or the blood's going to come backwards. It'll come through the tubing, and in some cases, if the bag's too low, into the bag.
Right.
So make sure that you keep this elevated. It's fed by gravity and nothing else. That's it. So IV skill. You got a hangover? Need some fluids on it? Need some fluids or no?
Not really.
You want to keep it in?